Welcome to Hitting Home. I'm your host, Megan Driscoll.
And I'm Becky Coletta.
And we are here to break down how decisions in D.C. affect our local communities.
Because all politics are local politics.
Welcome to Hitting Home. Hey, Becky.
Hi, Megan.
How are you?
Okay, how are you?
Good. I'm actually really excited about today's topic. I'm also a little fired up about it too, not gonna lie. We are gonna be talking about Medicaid today. And what the current administration has in terms of their plans, what they want to do with Medicaid. Just so people know, Medicaid is the country's largest health insurance program. It covers more than 70 million people in the United States. And I was actually really shocked at this number, but 40% of children get their health care through Medicaid, which is huge.
Yeah,
Big number.
It's everything from seniors who need to nursing home, it's people with disabilities who need medical care and home-based and group homes.
And just kids.
And kids.
Kids, just getting basic health care. So what happened recently and why we think this topic is so important, what we're going to be talking about today is the House of Representatives in like late January-ish voted 217 to 215, so not a single Democrat voted with them, to adopt a budget proposal that actually calls for $2 trillion worth of cuts in spending. But some of which is going to fall on cuts to Medicaid, right? Because it's
a big chunk of it.
Exactly. And the way that they're going to pay for this is through tax cuts.
About $4 trillion worth of tax cuts.
Exactly.
So it's going to actually, we're still going to have a big deficit.
Well, yeah, it's going to raise the deficit by $4 trillion. I believe that was the number. Yep. It's going to
decrease spending by a little over $2 trillion.
A little over $2 trillion. And it's going to give us $4 trillion worth of tax cuts. So I'm not really sure that the plan on its face actually works. I'm not
actually
sure
does much for anybody.
Yeah, exactly.
Right.
But we're going to get into the details about what that actually means for us. But this is a little bit of deja vu, because this is not the first time that the Republican Party has tried to make cuts to Medicaid.
Well, and the one optimistic piece about this is people think, what can I do? In 2017, when they tried to cut, $18 billion?
$800 billion.
$800 billion from Medicaid. And they got a lot of pushback because people from all sectors realize how much people rely on Medicaid. It's just unbelievable how many people rely on it. There was big pushback and they backed off.
Yeah, exactly.
So the question is, can we do that again?
Yeah, since it's already passed the House of Representatives, it still has to pass the Senate. We do know that if it were to pass the Senate, the president is in favor of these cuts, so it will happen. So we have a very somewhat finite amount of time here that we might be able to push back. But let's talk about how it affects Massachusetts. So in Massachusetts, 1.6 million people are on Medicaid. 34% of our children in Massachusetts are on Medicaid. That's a really big number. 62% of all people in nursing homes are on Medicaid.
And I've actually seen that number. Some people put it even higher.
Yeah, well, I think this is what I'm getting from the state. 50% of working age adults with disabilities. So half of a working adult on disability is on Medicaid. And what I think is really interesting that I didn't actually know, and I learned when we were doing some research for this show, is that 24% of the funds for Medicaid actually go to Medicare. So when you say we're going to pull money from Medicaid, you're also saying we're going to pull money from Medicare.
And I think it's important to remind people that Medicare is for people who are over 65.
Right.
Or people who are on certain forms of disability where you've worked and earned a disability payment, you would be on Medicare. Medicaid is for people who are below certain poverty or income and asset thresholds.
Exactly. And, one of the things that I think that is super important also, just as we talk about the sort of background of how we got here and what we can do, Massachusetts spent $23 billion on Medicaid in 2022. This is the most recent information we have. But the federal government pays 60% of that. So the money that we're talking about, so we're talking about 34% of children are on Medicaid. We're talking about 62% of people in nursing homes, 1.6 million people. But what we're talking about is $12 billion worth of federal funds. And that represents 50% of what the federal government gives Massachusetts in total federal funding.
And think about the total funding from the federal government is somewhere close to 30% of our budget in the state. So we're talking big numbers that the state can't just wave a magic wand and make up.
Yeah, no, the state can't. The state would have to, and this is what's at risk, really, is that we have people losing their coverage, and Massachusetts has to make a decision once again, similar to what we talked about on the education show, which was that the state has to make a decision about what it's going to fund and how, right? And so...
Right. And the governor was before the House Ways and Means Committee this week talking about that very issue.
Yeah.
You know, they don't... So this is a budget proposal. We don't know what's going to pass.
Yeah.
You know, they're still in the middle of negotiations. So everyone's trying to... We're just talking about the impact on Medicaid if this passes, and the reason why we want people to care about it at this stage.
Well, I think people, when they know, I mean, I think part of this is just educating the public on what's at stake. You know if you're on Medicaid and you're getting Medicaid services.
Right.
You know if your mom or your dad or your loved one is in a nursing home and receiving Medicaid coverage. The question is, what do you know? You know, you need to know that it's at risk, right? And that's
Right.
what we're here to tell you. Well, this is like a little bit of an alarm bell that, you know, if you know or love someone who is on Medicaid, it is at risk. And the state will not be able to just pick up the pieces the day two, because the consequences to cutting Medicaid are broader than just health insurance. And I think we should talk about what Medicaid needs in Massachusetts, because we have Mass Health and how they're interconnected with one another.
But as you were talking, Megan, I was thinking it really is important too that sometimes people don't see it until it hits them.
Right.
And as someone who's done some estate planning with folks, when they get to the point in their life where they're thinking about long-term care,
yeah,
they don't realize that Medicare doesn't pay for long-term care.
Right.
That it's a Medicaid program and you have to spend down to poverty to get it, or gift all of your assets away,
right,
which is what a lot of people do.
Yeah.
And they don't realize that if they, how many ways that this can affect them until it's almost too late.
Exactly. So Medicaid in Massachusetts, like, what is it called? Just so everybody can, you know, if you rely on services that fall into these categories, know that your services are at risk. So Mass Health. Mass Health is Massachusetts version of Medicaid, because we believe that health insurance is important here in the state, and we are one of the highest insured states in the country. I think we probably are the highest. I don't know.
Well, and you think about that. That goes back to the fact that we had expansions of Mass Health, and then we started to expand that into with Romney Care. We really started to put more insurance in place in Massachusetts, and then with Obamacare, the Affordable Care Act, that became an even bigger coverage. So most people in Massachusetts are covered by insurance.
Yeah. So the insurance companies that cover Medicaid beneficiaries are Always Health, BMC Health Net Plan, the Commonwealth Care Alliance, Fallon Health, Health New England, Bay State Healthcare Alliance, Navicare HMO, Senior Whole Health, Tufts Health Plan, and United Healthcare. So if you have any of those healthcare plans, you might be on Medicaid. You might be receiving Medicaid funds. The other thing too that I think people don't understand, and we talked a little bit about this, is that the Massachusetts Medicaid Home and Community-Based Service Programs. So these are programs like senior care options, elderly waiver, adult daycare, adult day health programs, personal care attendants.
Well,
the list is long.
Well, and sometimes people find out that they can get aides to come into the home if they take in a relative and care for them in the home, and they can get help in the home. This is based on Medicaid programs and waivers. And, you know, at some point we may talk about, if they turn this into a block grant, a different type of block grant, if it's going to allow those waivers, if it's going to allow it to be spent on some of the programs that we have here, that are wonderful programs for taking care of people who are disabled and seniors.
Yeah. The other thing too that I think is interesting and important to note is that the entire way our nursing and our healthcare system, it's set up around Medicaid funding, right? So cuts to healthcare programs would be devastating, ultimately. I mean, you're talking 2 out of 3 seniors are in nursing homes covered by Medicaid. And the Medicaid, those nursing homes can't continue operating in the way that they have been operating without those Medicaid funds. So you're talking about failure of health systems.
Well, we already see that nursing homes are really trying to make it work with limited dollars.
Right, barely making it work.
Barely making it work as it is.
If you had a loved one in a nursing home,
you know
what we're talking about. Yeah,
right.
Exactly. And their business models don't work without Medicaid. So nursing homes, community health centers, local regional hospitals, which have taken such a huge hit in Massachusetts already, and all the larger hospitals are feeling the effects of that. I mean, there will be no one in Massachusetts that won't be affected by Medicaid cuts, because you don't have to necessarily just be on Medicaid to have to deal with the ramifications of losing Medicaid.
Oh yeah, because what ends up happening, before we had most people insured in Massachusetts, you had a lot of free care, and a lot of hospitals were struggling to deal with free care because people just, you can't get blood out of a turnip. And we as a society generally aren't going to leave someone on the side of the road to die.
Right.
And I don't want to do that.
Yeah.
I assume most people don't.
They're going to show up at emergency rooms.
Right. So they're going to show up at emergency rooms. So what that was doing is putting a lot of pressure on private medical insurance premiums, right? And so if you take away dollars from the healthcare system and you still somehow are trying to keep people alive, if not healthy, you'll probably take away more primary care visits if this happens. Somebody's got to pay for that, right?
Yeah.
I mean,
well, we're going to pay for it.
We're going to pay for
our
it.
Health premiums.
Our
For
health
those that are
premiums
insured off of Medicaid, those that are not insured on Medicaid will end up paying for it through the increase in our own premiums. This is a little bit like we've already done this before. We were doing this, and now we solved the problem.
We tried to fix it.
We tried to fix it.
And now we're going backwards.
And now we're going backwards, and actually at a worse time, because we're talking about a healthcare system that's been devastated by what happened with COVID. So you have a healthcare, and again, like anybody who's been to the emergency room, and I have in the last 2 years, will tell you it's a disaster. And it's a disaster because of understaffing, and they're overwhelmed. And, and they're just kind of trying to come out of that, and they can't handle this hit. I am really concerned about that.
Well, and the other thing we have is that the NIH funding cuts are also going to hit our healthcare system, because we have a lot of clinical trials and a lot of care that's through these NIH-funded medical research programs. That's going to then fall back on private insurance. And the other thing we keep talking about are overrides. When I was first on a select board around here, I realized that so much of the insurance premium interplay with why we end up running out of money, because health insurance is a big chunk of our town's budget.
Right.
And so if we start to see that kind of increase in premiums again, we're going to have even more shortfalls at the local level.
Yeah. Well, it's trickle-down economics, really.
Yeah, it doesn't trickle down in the way people think it will.
It trickles down in the worst way possible. And again, so let's talk about by county. Okay, let's talk about what's going to happen at county level. So I'm just going to run through the counties and tell you, the listener, where you live, how, I think there's this idea that it's not in my backyard, or there's not that many people, So in Barnstable County, 21% of the total population of Barnstable County is on Medicaid or receive Medicaid's funding, and 33% of their children. Berkshire, it's 24% of the total county and 35% of children. Bristol, it's almost 30% and 36% for children. Dukes, it's 23% of the total population and 33% of children. Essex, 26%, 36% for children. Franklin, 24% total, 35%. Hampton, 32%, and then 42% of children. Hampshire County, 22% of the total population and 33% of children. Hampton County, 42%. I'm just going back to that for a second.
42% of the children.
That's almost 1 in 2 children are on Medicaid in Hampton County. That's insane. Okay. Middlesex County, 17% of the total population, 25% of children. Nantucket, 23% of total and 32% are on our children on Medicaid in Nantucket County. Norfolk.
Well, because those are the people who work and live on Nantucket year-round.
That's right. That doesn't account for
the wealthy who come there for the summer.
Exactly. Yeah. Norfolk is 18%, 26% of children. Plymouth County, which is where we live, 22% of the total population and 31% of children in Plymouth County are on Medicaid. Suffolk is 31% and 44% of children. I mean, that's urban and city. Worcester, 25%, and then 34% of children. So it's in all of our backyards, ultimately. That's kind of the idea that this is an urban issue, or that it's not.
Yeah, no, I mean, clearly Suffolk County is hit harder than maybe Plymouth County, 31% versus 44%, but That's a lot of kids, no matter how you shake it. And when we talk about Medicaid dollars and these kids, we're talking about, giving people a chance to have good health outcomes, right?
Yeah, exactly. I mean, that's one of the things too, in learning about this, that I was really actually quite surprised about. Well, I wasn't surprised about the better health outcomes, because it makes sense that if you're getting good primary care,
right,
you're obviously able to avoid, I mean, I'm sure we all know of somebody who didn't get care during COVID and who wound up having a much tougher outcome because they waited for care. So I think
like cancer was more advanced, heart disease was more advanced, all of these things.
Exactly. And I feel like we learned a lesson in that preventative care is so important. At least in my family, with the people that I know, we learned a really strong message that preventative care is critical. Even just like skin checks skin cancer progressed. Things that people just put off. And so what we're saying is we're going to do that to like 30% of the children. And even if you don't care about adults, we do care about children, right? We care about children and their health outcomes.
I think we do. And then when we think about children and their health outcomes, it's also, they're supporting our kids in schools. When we talk about special education and whether we're going to lose funding under IDEA and for other supports in the school system, kids with disabilities sometimes come to the school very medically involved. And sometimes kids without intellectual disabilities have other disabilities that are medically involved.
Yeah.
And Medicaid helps to support those kids in schools.
Yeah. Well, they have this school-based care for all Medicaid-eligible children. That was something I actually didn't know. It's called the SBMP. We'll link it in the show notes. Like, there's a website that you can go to and you can actually see where all of these school-based school-based health programs are. But I think it was put in place in 2019. It was expanded upon. 86% of Massachusetts students visit the school nurse at least once a year. That's, I guess that makes sense. I guess probably my kids are there. But the children who are receiving healthcare services in schools miss fewer days, better equipped to learn. There's a lot of fall down benefits to the school system when they have these school-based programs and sort of catching kids before something becomes something bigger,
And allowing them to be in school and reach their full potential for some kids.
Yeah, exactly. Well, I think that, I looked up the research. There's just a ton of research. So children specifically who have checkups have lower rates of missing medical care, prescription drugs, lower need for advanced dental care, specialist care, mental health care, vision care. So we are saving money by providing children with preventative care. And the only way that those children are going to get preventative care is through Medicaid.
At least
right now.
At least a third of them, right?
Exactly.
And so what right now we have this sort of continuum, right? Because we have Medicaid and Mass Health, and then we have the we have the sort of the ACA plans.
Yes.
That allow people to pay less premiums if they're within, say, 200 or 300% of the poverty line. And so we've expanded it, and I don't know if we'll have the money to still do that if we lose federal Medicaid dollars.
Exactly. Well, and just to talk, in thinking about this, again, it goes to this just assault on the working person, right? This is not going to affect the top 5% of Massachusetts earners. It's not. They are
probably not even going to affect the top 25 or 35%.
Yeah, so we're talking, this is going to affect 70% of our working class people. This is people earning $150,000 a year as a family or $200,000 a year as a family. It is going to affect them in a bigger way.
Well, and people are going to, I was hoping we would end up with more help for families with nursing home care and more help for nursing homes.
Yeah.
And it looks like we're going to end up with less.
Yeah.
And that was really my hope, was this. As I saw the baby boomers coming of age, and I saw people realizing that the only way they could get long-term care was to sell their family home, leave nothing to their children, bankrupt themselves so that they could get on Medicaid and get help with their care. I just felt like, maybe we would actually, as a society, decide that taking care of people as they age is important.
Do you think people have forgotten about that time when that happened? Do you think we've gotten too comfortable with with what we currently have to not appreciate it?
I think people think they can go it alone until something happens.
Yeah.
And then they're always surprised, well, won't the government help me?
Yeah.
And, I've seen it happen in my own life with people who got really, really sick and thought, well, isn't the government going to take care of this person in my life? And it's like, not necessarily.
No, yeah, it's not a guarantee.
It's not a guarantee. We don't. Not if we cut back.
Exactly. We don't even, we're kind of barely taking care of it now, not if we cut back. I also think the burden that this puts on families who have young children too. So you have young children and you have elderly parents, hopefully still alive and
right,
living.
I do actually.
Yeah, and I do as well. And the burden that it puts on you to think about that 2 out of every 3 people in a nursing home is on Medicaid. So then what? So what do those families do? They're raising young children. Their health insurance maybe they have a child on Medicaid. Maybe, who knows? Right. Or maybe they're on Medicaid themselves, and now they have aging parents that are getting their nursing home closes.
Right. And so you're bringing someone home into an already crowded house because housing is an issue that we'll talk about at some point.
Yeah.
And so the pressures are happening on a lot of the same families.
Yeah.
If you're talking about educational support, you're talking about healthcare support, you're talking about, we haven't even gotten into unions and the ability to support workers more directly. And then medical insurance goes away. I mean, it's a lot for working families to take on.
Yeah. Well, and even too, I was thinking about this, just the realities of this. It is so stressful to have a loved one in a nursing care facility. On the one hand, you feel like, okay, they're protected, they're safe, but the pressure and the stress that it puts on you for however long they're living in that environment, and to face the potential reality of that facility closing or that person having to, I'm not qualified to give nursing care around the clock. So then what?
Right.
And I just think that it's just too much chaos. It's too much pressure on a working family, and it benefits of such a small. I don't actually think that cutting Medicaid benefits anyone, to be honest, but
it reduces some spending, but then what ends up happening is all of that reduction in spending is being routed to the wealthiest in the country who
through
really
tax breaks.
Through tax breaks.
Yeah, we're going to do a show. Our next show is actually going to be on tax breaks, and we're going to talk about how it's really just a transfer of wealth from the top 5% down to the from the bottom to the top 5%. The people that are really going to win in tax breaks are the people who earn over $400,000 a year.
And the other thing that really worries me, so I spent about 10 years on the Human Rights Committee for Road to Responsibility, which is a fairly large provider of group homes and day programs for people with intellectual and developmental disabilities. And you see over time that it's harder and harder for people to be hired because housing costs are so high. And even with a reimbursement rate that allows you to pay $20 an hour for direct care services, it's really hard to find enough people, good people. If the payments get shaved back for those programs, because most, I would say the majority of the funding for those programs comes from Medicaid.
Yeah, of course.
Some of it is from other housing programs and other programs, but a lot of it comes from Medicaid because these are people who are disabled.
Yeah, right.
And I just don't, I've always felt like when I went to those programs, they're really well run, they're really good programs, they make people feel like they live in a home, and people are so well cared for, and it made me feel so good that we...
Well, they also are getting work. They're being provided with career counseling. All kinds of things.
Well, depending on what level of disability they have.
Yeah.
And I just can't imagine us as a society saying, oh no, we're going to cut back funding there, so people aren't going to have day programs to go to, or people aren't going to have sufficient support in group homes to live safely and effectively in a group home setting.
Yeah. It's far-reaching. It's far-reaching, and also, again, I just want to hit this home that we are talking about 40% of the state is going to have a direct hit to this from themselves, and it's probably 100% of people are going to feel the effects of this.
Well, no, there's some very wealthy people who can take care of their parents.
Exactly, but that's stressful too. Now that all of a sudden,
right.
It's going to hit everybody, because if you make $1 million and your mother-in-law is
there's probably a few billionaires in the state
who
that
don't care. Won't care. But for the most part, people are going to be affected by this no matter what, and it's going to affect their purse, and it's going to affect their actual health care. It's going to disproportionately hurt children, which makes me crazy. So we have a call to action, because in 2017, we were able to, as a country, push back on this Medicaid, slashing of Medicaid, and they heard you. So we want you to call the White House, actually, because in Massachusetts, you can call your state representatives, but
your
congressional representatives,
but they're in the minority right now.
And they didn't vote for this. So
they support Medicaid.
They support Medicaid. So the best number to call is 202-456-1414. That's the White House switchboard. So you can actually call and hopefully just shut it down with your comments about how important Medicaid is and how it would affect you. And then we would love to hear back from you. If you have a family member or in any way are directly affected by the cuts to Medicaid, we'd like to hear those stories back too.
And we'll find a way to sort of chat about those on other episodes.
Yeah, or even bring on some people who listen and talk about their stories and bring this to real life. Yeah, exactly. So we will put all the notes in the show notes, so you can actually find links to all the information that we shared with today. We're so appreciative that you've been able to come spend this half an hour with Becky and I. We hope you continue to keep listening. Thank you for listening, and follow us on our social streams, and yeah, especially
all
Facebook, politics are
YouTube.
local politics.
All politics are local. Have a good day, Megan.
Yeah, you too.